Well, in general, the state of reproductive health and rights in Malta, sexual reproductive health and rights, is quite bleak. Basically, to start off with, obviously, that abortion is illegal. Having abortion in Malta carries up to 3-year prison sentence for women and 4-year prison sentence for doctors in case they perform abortion. And it has been like that since 1850s, the law. There were some changes throughout years, because like at the beginning, the law basically stated that apart from prison, it's a hard labor, and then in the 80s they removed hard labor and things like that. Cosmetic little changes. And the only change that really happened 2 years ago, where they basically introduced one single exception, because there are no exceptions at law for rape, incest, fetal anomaly, nothing. They introduced one exception where originally they proposed that in the case of severe, grievous risk to women's health and life, doctors can perform abortion, but that's after big protests and background dealing and so on and so forth was changed to only when woman's life is at imminent risk. When health deteriorates so much that her life is at risk, and in order to do it, it has to be approved by 3 medical professionals. So in a way, we believe that they actually made it worse. Because before abortions that were risk for women's health, a doctor would do what they had to do. Although on paper it was illegal, they would save women's life. And in order that to be a crime, somebody had to go to the police and report that. But that never happened. That never happened in history. But now, doctors cannot just go ahead and do it. They need to ask approval of another 2 doctors. So in a way, in terms of how everything takes place, they made it worse, because obviously getting approval of 3 doctors, it takes time. So it's a bit delayed. So in a way, we think they actually made it worse. Secondly, this law, this change in law was done basically to protect doctors, not to protect women's life. So they made an exception which gives doctors a legal cover, which they did not have before. When it comes to other things related to sexual and reproductive health, contraception is not free. And it's not all that easily available. It's pricey. And the sexual education is sporadic. There is a sex and relationship education in schools. There is actually government prescribed guidelines for teaching sex and health education, sex and relationship education, but they are a bit dated because they are written 2010, but they're not bad, let's say. But it very much, they're guidelines, which means they are not obligatory to be followed, and everything depends on the school and on the teacher, because the same guidelines can be used basically to scare children and teenagers from having sex, or they can get a proper sex and sexual education. So in a good school, I know a couple of good schools because I work in visiting schools, that the teachers and the management of the school, they're on the same wavelength, so they have resources, and all the kids in those schools get great sexual education. There's no question about it. But then there are schools which are run by church, for instance, they do get some sort of sexual education, but it's basically mostly mechanics of it, and it's not very explicit, and it's very limited in scope. Considering that 1/3 of schools are run by Roman Catholic Church, that means, that doesn't look good. And the sexual health policy of the sexual reproductive health policy of the country is also very, very old. It's from 2011 or something. And just last November, after doing some research about, sexual health in Malta, the government came up with a sexual health strategy, which is right now being put up for consultation. And till 11th of February, the public has a chance to offer their ideas and comments on what government intend doing. Again, there is a lot of good stuff in that document. Although it's not really clear how, there is no timetable or schedule of implementation and who's going to control or check if that's happening. And also, obviously, although in the document that government is proposing, they recognize that there are around 500 women take abortion pills every year in Malta, but they are offering no solution, no change in law, no nothing, no action on abortion. So more or less, that is the state of sexual reproductive health in Malta. Unlike, for instance, Poland, that has also very restrictive law. In Poland, women taking abortion pills, which are available now, they are reputable sources that you can contact, and you can purchase these pills or get them against donation, basically. It's a very safe procedure. It's way more safer than having a medical abortion or things like that, surgical abortion. We know that around 500 in Poland, that kind of abortion is not illegal, i.e., women are not prosecuted for having self-administered abortion if they do it on their own. In Malta, that is illegal still, and we know we have contacts with main providers of abortion pills, which are Women Help Women and Women on Web. And we know exactly for last 5 years how many women had ordered pills and taken them at home. And in the last year that we have exact figure is 2023, and the number is just close to 500, 400 something. I can't remember the exact number, but that's, as I said, from two main sources of pills. That's illegal, and occasionally women get reported to the police for it. Apart from that, we know that because Malta has a large population of foreigners, we know that people from Europe, usually they travel to their own home country to have an abortion, but there is no way of us knowing how many. And we also, the only one that we sort of know is that there are women that go to UK. UK keep actually statistics on nationality of women having abortion in the country, and until COVID hit and the airports were shut down and things like that, we had an average, I think, around 64 women every year going to England for abortion. But that is now, obviously, as the number of women ordering pills exploded, and it's now at 500, close to 500, the number of women traveling to England for abortion is down to like 4 or 5, which we think are like seriously sad cases of fetal deformity and genetic disorders and things like that. Yeah, basically that's what happens. Yes, and that's illegal. Taking pills is illegal. Having self-administered abortion is illegal. And we just recently got the data from the police that I think 7 women, I'll tell you, 2, 4, 5, since 2012, 7 women have been reported to the police for having an abortion. In two cases, police took no action because they didn't issue any charges. In other cases, charges were issued and women were either um, found guilty, but they were not sent to prison, or they were given some sort of sentence, but none of them went to prison. It was always a conditional discharge or something like that. And we know that there are currently two cases which are still going through the courts of women who had taken abortion pills. They have been reported mostly by their partners, by their ex-partners or things like that. Two of them were reported by their doctors, and one of them, I think, was reported by a social worker. The law is obviously discriminatory because you can, before before the abortion pills became so popular, um, women that have abortion abroad would not be prosecuted, obviously, because that happened, it's extraterritorial. Malta has no jurisdiction what happens in other places. So abortion was always available in Malta if you are rich enough. So if you had money to travel and have it abroad, it was okay. So but if you have money, but if you are teenager and you can't travel on your own, or if you're young and you can't travel, you can't afford to travel, or if you're an immigrant without a legal status, so you cannot, if you're a refugee or things like that, you cannot travel, and or if you're poor, if you just can't afford it, and because these things cost money in UK, the further down and every delay increases the price, so the longer you take to collect money to go, that obviously it's basically it was reserved for people of means. So the health in Malta in every respect is good healthcare. It's free of charge at the point when you go to the hospital or the healthcare or health center. That's all free. And it's performing really, really, really well. Just that when it comes to abortion, it's discriminatory. I'm not gonna say that. I mean, the doctors do good job here. We have good gynecologists, good healthcare system, but when it comes to abortion, yes, the law does not allow it, and public opinion and many doctors' opinion is against it. You can also, because we have parallel, you can go to the doctor for free. That's all. But you can also choose to go privately if you can afford to pay. You can go to private clinics and see the gynecologist of your choice. But it's against the payment. But you don't have to. That's a choice if you obviously can afford it. Yeah. No, we have. Well, I mean, I think every health system has these kind of problems, but Malta. We have one. You have to consider the size. Malta is around 500,000, 550,000 Maltese, around 200,000 foreigners live on the island. And we have one major government hospital, which is quite big. And it's the staff there is quite international. Malta hires people from abroad to work here. So we have doctors from, it's not you'll go into the for an operation, and very likely that the team of doctors will be from 3 or 4 different countries and things like that. The nurses as well and support staff are all, many foreigners work in the system. So yes, you can. It's not accessibility to a gynecologist is not the problem. You will find a doctor, but you won't get abortion if you need one. I think, well, when we first started talking about doing something, you have to understand that Malta did not have divorce until 2011, and then morning after pill or emergency contraception was not licensed in Malta because it was considered abortive. And so in 2016, a women's rights organization, Women's Rights Foundation, which is an organization founded by my wife, and her team of lawyers, they actually threatened to sue the state if they don't license them the morning after pill. And it took 6 months, but since December of 2016, contraceptive morning after pill is available in Malta. Although pharmacists have a right not to keep it in the pharmacy, so some pharmacists have a right to conscientious objection, so they don't provide it. But you can find it. The problem is a little bit on Sundays because only few pharmacies work on Sunday. Um, when it all started, basically, the polls were showing that around 98% of the population is opposed to abortion in any way, and high 80% were even against having abortion to save women's life. Because there are many reasons for it, but Malta is an insular, tiny island where Roman Catholic Church had and still has a lot of influence, not as much as before. And the teachings of the church are very, very much very strong. Majority of the population still declares themselves Catholics, although they don't really, but on paper, on certain things, yes, they are very, very religious, and church teachings are, strong. Beliefs are strong. That life starts at conception. It's a very strong belief. A lot of people believe that, unjustifiably, but they believe that to be a scientific fact. A lot of people believe that the role of a woman in a society is sacrificial. That woman should sacrifice everything for her family. So yes, even dying to a lot of people still believe that that's okay. And that's basically that should be a woman's role, this Madonna syndrome, sort of, woman has to be like, which, this ideal that is unachievable, kind of. So yes, things change. We ran polls, and the younger generation, if you ask them, especially younger generation, people up to 35 years of age, if you ask them, do you think that women who had abortion should go to prison? We have majority saying no. But if you ask them, should we legalize abortion, for certain things, majority is still against it. So it's a bit of a, confusion. We had a recent Eurobarometer data that came out, just to how there are a lot of oxymoron sort of situation when it comes to women. The 88% of the population agreed that in marriage or partnership, both men and women should be financially independent, which is nice, and a good opinion to have and expect. But at the same time, 63% also believe that women should prioritize family and children over their careers. There are these kind of beliefs about women, like, okay, you should be independent, but you shouldn't work, because you have kids. It's a bit of a, um, things are getting better, but especially when it comes to financial independence of women, so but very slow. And on abortion, opinions have been changing, but again, it's been very, very slow. When it comes politically, because you mentioned it political, we have two major parties which basically change. They are the only ones in parliament. We have sort of a Labour Party, which should be sort of socialist, but it's more liberal, business friendly and stuff like that. They are members of this party who are, we know that they are pro-choice and they're supportive, but they follow the party line. So if if their political party thinks that this is a losing issue, they will keep quiet. This political party stance on abortion is there should be more discussion about it. but a discussion in sort of in the public, not politically in parliament. And the other party is so-called Nationalist Party, which is a right-wing, center right, religious, with a lot of religious background, and they are adamantly opposed to abortion in any kind and form. Actually, they worked really, really hard because, as I told you, when they changed the law, it was women's health and life. So they basically campaigned really hard together with church and so-called pro-life organizations, because they claimed, women's health is going to be anything. So if there will be abortion left, right, and center. Although the proposed law said a grievous risk to health, but they completely ignored that part. Anyway, so yeah, politically, no, there is currently, especially because this changing even this law, a little bit of protecting doctors was a big thing. So there is not much political will right now to tackle the issue of abortion at all. Okay, so until recently, when recently, I mean, couple of years ago, there was a EU directive on parental leave. Until recently, women had guaranteed 16 weeks, no, 12 weeks. So this is how it was. So 12 weeks of fully paid leave, and then they had a right for another. They added another 4 weeks as unpaid. And men had a right to, I think, 2 days or 1 day or 2 days, I can't remember, of for birth of child. But then with the European directive, they changed that. Yes, and the people that work for the government, they had an option of taking up to 4 months. The government employees. And with the recent directive, they changed it, but women still have, I think, the same. But they introduced, I think, 12 days or 2 weeks for men that men now can take, which was a minimum at law. Okay, so basically, as it is now, women have up to 16 weeks, 4 months, and men have 2 weeks. And the Nationalist Party, the Conservative Party, right now, they just yesterday or day before yesterday, they came up with a last Friday, yes, they came up with a proposal to give men and women 1 year of fully paid leave, where there would be a proportion reserved for a woman, obviously giving birth and whatever, and then the rest would be shared between the two, and it would be fully paid, not by minimum wage, but median wage, which is a little bit better. And it was proposed by the Conservative Party. And I understand there is a lot of talk about birth rates in Malta, because Malta has the lowest birth rates in Europe. It's like 1.04 or something like that, when you need minimum of 2.1 to sort of replace replacement value. So Malta has the lowest, absolutely lowest birth rate. No, I just want to. I don't know if it's what you're gonna do. You can use everything that I said. I have absolutely no problem with that. I just want to say that I'm talking on behalf of Voice for Choice, which is a coalition. Which is a coalition of around 10 human rights organizations. There were obviously women's rights organizations who worked on it before, from 2000, the Women's Rights Foundation, for instance, and things like that. But the coalition started in 2019. And basically, we advocate for reproductive rights, and apart from advocating, lobbying, and things like that, organizing protests, and because for instance, in 2014 and in 2020, we had the women who were airlifted. They were about to die, and doctors wouldn't do an abortion, and their insurance companies, because luckily they both were from abroad and they had insurance, So they were airlifted, by special planes from Malta and taken to other countries, to France and to Spain, to have abortion. So we advocate for, obviously, for that, and we also provide information on how to safely obtain abortion pills. We have our sort of little service. It's online. It's a phone, email, or a chat, where you can ask the information, any information about reproductive health and rights, because the government will not provide it. So we will, on abortion, we will basically provide information to the people on how to do it. We have been reported to the police for that, not more than once, but sharing information is legal and protected in European Union, so they cannot touch us there. So yeah, that's what we are doing.